Hi, it's Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma. COVID update, February 11, 2021. So first, I hope everyone in the Oklahoma City and Midwest is doing okay with the cold weather, the ice, the upcoming snowstorm here in Oklahoma City on Monday. It's cold everywhere in the U.S. It's snowing in a lot of places, so everyone be safe. So let's talk about COVID. Let's talk about masks first, since the CDC director, whose name is Walensky, I'm sure someone will correct me, gave a talk about masks yesterday. First, a big shout out to Dr. Julie Watson, who's in my COVID task force, really the co-director with me. I kind of felt like Dr. Walensky's speech is pretty much copied Dr. Watson's original work from early in November, the pauses and a lot of the language in it. So big shout out to Julie Watson. I think you kind of got copied there in the first 2 minutes of her announcement on masks. From that point, though, there was some deviation from Dr. Watson, who's very science driven. This whole thing with wearing 2 masks, let's talk about that. So the CDC director said if you wear 2 masks, there's a 95% reduction in droplet spread and potentially infection. There's no evidence it actually prevents infection. I want to emphasize that. But droplet spread versus not wearing a mask, and that's why they're encouraging that. The interesting thing that she neglected to give, which is pretty basic, is what's the reduction in droplet spread with 1 mask? Because that's the true difference. I mean, is it worth it to wear 2 versus 1? Obviously, we want masks to be tight-fitting, which I think is an important point, and the more important point, if you can get a KN95, that's a very important point too. But I mean, those are harder to get. But the bottom line, you need a well-fitting mask. Without the difference between announcing what 1 and 2 is, between wearing 1 and 2, I think it's a meaningless suggestion because the CDC has no credibility. Sorry if you believe them, because they do things without any data, and they ignore data that shows benefit. Like she didn't mention the peer-reviewed published journal article that showed a 96 or 97% reduction in ICU admission in patients giving high-dose vitamin D at admission with COVID. That we don't want to talk about any of that stuff. But so I would not, and so I looked for the study. I looked for any studies that are published on PubMed on 2 masks. There's none. There's no data published. They won't say their sources. They won't give the numbers. They just take it on faith. We know at the CDC after blowing testing and all the other things they've blown. So I think the 2 mask thing seems stupid. Interestingly enough, though, I found a paper that flies in the face of everything about why masks are important. It is not as much about droplet spread with masks as these authors are offering. It's the humidity content in your respiratory secretions gets to over 100% humidity, or not over 100, but to 100% humidity with wearing a mask consistently, which actually is probably pretty inhibitory to toxic to COVID. The humidity is too high for the COVID virus to propagate. So very interesting that it may be working through a totally separate mechanism. I think there'll be problems with people wearing 2 masks, plus people aren't going to do it. So it just seems like let's have some real science from the CDC. Let's get it peer-reviewed and published before we make all these recommendations. The next thing they're going to recommend is testing before you get on a plane for domestic travel. That makes no sense. I mean, so much of what they do makes no sense. There's no scientific validity. It's very disappointing. I mean, there's data showing that hydroxychloroquine works, yes, for early use. So the ivermectin data shows the same thing. I'm flabbergasted by it all. As we go further and further down this road of failure with our governmental agencies, which probably means I'm going to get this one pulled off, but so I don't care. These people are just unfathomably incompetent and just reactionary, and let's close everything down when the number 1 cause for the virus spreading at this point is the weather. That's other data I've mentioned too. So I don't know what else to say about that. I think on the positive side, we have 45% of the people over the age of 65 in the United States vaccinated. We have 15% of the total population probably by now, because the statistics is a couple days old. It's probably 16 or 17%. So we just got to keep on whacking away at the at vaccination. And again, the CDC, I'm glad they spent more time and the FDA on this kind of stuff than actually reviewing the Johnson & Johnson vaccine efficacy data from the phase 3 trial, which we've not seen yet, because that's really what counts. But anyway.
There is one thing they came out with that I don't know, you just got home, so I don't know if you've seen it. Fully vaccinated people 2 weeks after the second vaccine don't need to quarantine if exposed. That's from the CDC.
Oh, that's new. Finally, something that the vaccine works. So 2 weeks after the second vaccine, which makes even less sense, because it should be 7 days by their own data. They've said 2 weeks. Okay, so again, let's give a recommendation. It's a positive, but let's be honest, it's stupid too, because your antibodies are elevated 7 days after day 28. There's no difference in vaccine antibody levels statistically between day 28 and day 35, or 7 to 14 days. That's published data in the New England Journal of Medicine. There's no benefit. God, it's disturbing. It's just horrible. So if any of you think that there's a conspiracy, there is. It's a conspiracy of incompetence for people who are in governmental medical areas, and probably to an extent an academic when it comes to stuff like this. But everyone's going to hate me, so I don't care. Go ahead. What are the other questions, Kim? What questions?
Are we there now?
We're there. That's probably my big comment.
Okay.
I mean, variants. There's no data showing the variants we need to be scared of. Okay, they're going to overreact to the variants because they got to keep you scared, so you're a lemming, and I just can't stand it anymore.
Okay, so what are your thoughts on the BAM infusion?
The BAM infusion is a monoclonal antibody. It's awesome. We originally thought it was maybe okay, then okay. It works really, really well. I referred 2 people for it today who were early infected. And in Oklahoma City, big shout out. There's a place on the south side, I'm sorry, I can't remember the name, maybe the Finch Clinic or something. On the north side in Edmond, Oklahoma Arthritis Center, led by Dr. Craig Carson, Dr. Zacharias, Dr. Kumar, and several. There's a great team there of PAs and nurse practitioners and other physicians, but those are the 3 I know best. And so great folks. They have the BAM infusion. If you're recently infected with COVID, you have a positive culture, you have some high risk factors, please call. But even if you don't have high risk factors, if you're recently infected, call, because you can still qualify as long as it's early. You never know who's going to get sick. At our COVID task force meeting, the vast majority of patients in all the ICUs were what we call phase 4 or low risk patients. So that's a great alternative for people.
Okay. Oh, one person was asking you, in your words, to describe the difference in a compounding pharmacy and a pharmacy.
Well, there's crossover. So think of a compounding pharmacy as old school. Back in the 40s, they would have all the medicines in a jar and the pharmacist would put them together for you. So a compounding pharmacy will take individual components of FDA-approved products and make them more specifically for someone or to address a problem, versus a regular pharmacy that doesn't have that capability. They have just standard stuff. So what's an example? You have a 3-year-old who has really bad nausea and is vomiting. What do you do for them? They can't swallow a pill, or they're a 5-year-old and they can't swallow a pill. So you can go to a compounding, your doctor or provider can call a compounding pharmacy and put Phenergan put it in a lollipop form, and they can just suck on it to get the nausea. And they can do that for all different kinds of medicines. It's just an example. For hormones, what we use compounding for the most part, we can individualize the therapy doses for people, and like the product we use for natural progesterone that's at all the pharmacies with peanut oil, which helps its absorption. The problem with that is if you're allergic to peanuts, we can't give people that one. We don't want to give them synthetic versions of progestin because we don't want to increase the risk for breast cancer or stroke or weight gain or headache or hair loss. So we write a prescription for the same amount of the progesterone, like 100 milligrams or 200 milligrams, and they go to the compounding pharmacy and they take that powder and mix it with another agent that's fairly inert and turn it into a capsule, instead of having a capsule with peanut oil in it, which is the branded product. So those are examples of roles for compounding pharmacies. Compounding pharmacies are essential in the United States. The FDA is trying to overregulate them. It's sponsored by Big Pharma. It will be a disaster for healthcare in the United States. We get tons of compounded medicines at all the hospitals in the United States because there's shortages. And if we didn't have compounders to make propofol and different antibiotics, or take those products and put it in a form that we could use in the hospital when there's shortages, we would be doomed. It would ruin hormone replacement therapy in the United States. It would ruin a lot of pediatric treatments. It would be absolutely horrible not to have compounding pharmacies. Now, we want high quality ones, and thus and so, but that's a separate subject.
Okay. After the second dose of the vaccine, can you tell them again what the name of the antibody test to do and when to get it?
So the name of the antibody test, we recommend one and only one. It's the LabCorp SARS-2 COVID quantitative antibody test. So you can see what your level of antibodies are. And so very straightforward. It's the only one we use. It is a specific test for the antibodies that bind to the S1 region of the receptor binding domain of the spike protein, which is the primary site. And that's where antibodies bind to inactivate the virus. There's also, so that's at the tip of the spike. There's antibodies that can bind here, but that's the main one we're measuring for people.
So after you get both vaccines, on your supplements, do you do like your post-COVID or same as you were before?
Same as you were before. I mean, I think if you're more than a week out from your second vaccine, I think it's fine to decrease your zinc to 3 times a week. I'd pretty much stay on your vitamin D. We want everyone on vitamin D, fish oil, and a multivitamin no matter what all the time. The role for elderberry you can cut back to. Melatonin, I think you can cut back to a couple times a week, unless you like it for other reasons. And that's your core stuff. Same thing with vitamin C, a couple times a week. That's always going to be beneficial. I mean, the thing to understand about immune function is why wouldn't we want our immune function to be better? And so, because all the same things that can help you fight off COVID can fight off all the other viruses and flu bugs that you can get.
I don't think you had vitamin C on your list for the amounts.
Oh, usually just if you're just for maintenance, 1,000 a day. But I mean, vitamin C is really harmless. So whether you do 1,000 or 2,000 is okay. If you get an active infection, I would go with 1,000 4 times a day.
Okay. So these other two have been asked before, but they're asked again.
Well,
so,
make a different answer for them this time.
Good. So somebody got the vaccine and then tested positive like 5 days later. Do they still get the second vaccine on schedule?
My answer for that is no. Do you get the vaccine? I'm a conservative. I don't think people should get the vaccine within 3 months of an infection. I think you don't want to see if you're the really unlucky one who has this incredibly nasty immune response. I just don't think it makes sense. I'm maybe an outlier, but we know that the second vaccine is going to augment your first vaccine. And plus, if you've gotten the infection, you're going to make antibodies. And so you're kind of already gotten 2, so you can do the other one later.
Does that answer change at all if you're pretty asymptomatic with the positive test?
No,
Okay.
it doesn't. I mean, the thing to keep in mind about reinfection, from reading more and more about it, and the Marine paper, the Marine recruits, and looking at all of this, probably about 5% of the population has a very limited long-term immune response to lots of viruses, so they can potentially get reinfected. It may be a little less, it may be a little more, but it's somewhere in that range. Then that's what the data is showing from the Pfizer vaccine and the Moderna. About 5% of people don't respond. So again, there's always going to be outliers, but when you're doing public health things, it's the role of trying to take care of the greatest amount of people the most straightforward way. And so if you have the ability to individualize your own personal care, which I do as someone who knows about medicine and this stuff, I checked my antibodies. I wanted to know. I have had a bazillion, at this point, exposures. I've never gotten it. Maybe had cross immunity. Maybe it was all the supplements. Maybe it was taking the Plaquenil on a fairly regular basis and then supplementing a little bit with ivermectin before I got the vaccine. But now I have really high antibodies. They're off the chart. So I'm still doing all my supplements, but I've cut back as I've described because I don't think I need to be doing as much because I have immunity. But I'm still supporting my immune system. Because there's always a chance there's going to be, and it doesn't exist yet, a variant that really matters for people who've had it or people who, when you look at the large groups of people, so a large group of people who've had it or a large group of people who've had the vaccine, that variant isn't here yet. It may never happen. It could happen.
Okay, and then why would you have negative antibodies after the vaccine? I know you've been asked this almost every time, but people are still asking.
So there's a couple of reasons. The base reason, if you don't ever make antibodies after the vaccine, your immune system didn't respond. But did it not respond because your immune system's terrible or because they screwed up the vaccine and what you got, they either kept it out too long or something went wrong with the way they gave the shot, but mostly it could be an either or, where your immune system doesn't respond or you got a bad batch of the vaccine in terms of being inactivated. So you have multiple choices of what you could do. You could switch to a different vaccine when the Johnson & Johnson, if it gets approved, you could do that, or the Novavax when it comes out, because they're not messenger RNA vaccines. You could see an immunologist. Again, Amy Darter in Edmond has the ability to actually check your immune system for functionality if you didn't respond to the vaccine. So again, there's choices for that. You can talk to your provider about what those are if they have any earthly idea. And so think immunologist. So an allergist and immunologist, they're always together. They get that training. So they can do that testing. But since I've talked to Dr. Amy Darter about this, they have the lab equipment to check your immune system to see if you have a functionality problem, which runs about 5% of the population. So that's it. So let's stay positive. Long rambling talk tonight, and I'm sorry I'm feeling a little down about our government response, but I don't think closing our borders or over-testing anymore just to make money from the government who pays for most of it, I think all of it's stupid. Let's get back to normal. Let's wear our masks. Let's get vaccinated. The vaccines are fine. Every day I talk to people who don't want to get the vaccine. I'm very respectful about it, but I'm telling you, unless we all get vaccinated, we're going to end up with worse disease, because what is happening is you get combination infections in people who haven't been infected, and then the virus mutates or contaminates, and then you get weird secondary viruses, and that's what's going to cause us a problem eventually. So anyway, be at peace.
I think you got to expand that. I don't think you can. What?
So what happens is some people who get an infection actually get two different strains at once, is what it's looking like occasionally. And then those two strains interact in the body, and you can then get this hybrid strain from those two that is more aggressive or different. And that's what we think has happened potentially with some of the Brazilian strains, the English strain and the South African strain. So it's just, unless we get everyone vaccinated, we're going to have more and more mutations that become more difficult to deal with. So, and not that I'm saying we're mandating vaccines, I'm saying let's get herd immunity, and because eventually we're going to have enough infected people, and at the rate our vaccination program's going, we're going to have a ton more infected people. And I know 2 people right now personally who are in critical condition and doing very poorly, and it does happen. They were, my age guys, reasonably healthy, nothing major, and they're both, critically ill. So let's keep everyone in our thoughts and prayers right now who gets exposed to COVID or has any other problems for that matter. And so be good. Thank you.